This is the Neuroflex Restorative Flex Hand. It comes to you like this. You pull out the cones. Now we also have, this would be for patients whose hands are a little more open on the little finger side and maybe more closed on the medial side, the thumb side. You can take all the way from closed fists up to moderately open hands. This is a great hand splint for them. They also come in reverse cones for those who are tighter at the little finger and have more range at the index finger and thumb. Also, they come in cylinders, which would just be rolls, so you have the versatility, order what you specifically need for your patient. But the original was the cone, and this is what will come with your flex hand when you order it if you don't specify. If your patient has a tight fist, you want to try to make sure it has been cleaned as much as possible before you start. This is the only time I wear gloves, is using hands. I'm an old nurse and I like therapeutic touch and hands-on. But with a patient with even a moderately closed palm, you'll have fungus, bacteria, yeast, anything that can grow in a moist, warm, dark environment will grow in that hand. So I do try to make sure they're clean, and then I will wear gloves. If you also massage that hand, if you massage it just a little, you can put your fingers in each side of that closed fist and just massage all down through the fingers, and that will loosen them up a bit. Also, if you try not to appear to rush. We're all in a hurry to get everything done, but if you can try to create a calm environment, it certainly helps. The massage and the talking to them softly will help them to trust you and to relax somewhat, so that all plays into what we're doing. For a tight fist, you can fold this back. You always know the left goes this way, a right would go this way. You have to order right or left, but the palmar bar always points with the thumb, so it's easy to identify a left and a right. You can start here and simply work in the palm. I like to hold it up, hook the fingernails, and roll it in. You never want to pull out on fingers or a thumb. They're very, very painful, and you want to sneak whatever you're putting in there in. Just having this in will take the fingernails out of the palm. It will start to get a little airflow, and it will start to loosen up those contracture joints. Thumbs are very, very painful. This area is called thenar eminence. Now, this is adduction, but this is thenar eminence collapse. And why that is so important, besides just being very painful, and this is from newborns on up, is once you lose the function of that thumb, there's so many things that you're unable to do. If you keep the thumb lifted, elevated to where you can do pinching actions, you can feed yourself, you can brush your teeth, you can turn pages of a magazine, you can hit a remote control. So many things that are just so important that you don't want to have to rely on somebody else to do for you. So we have the hand here. That thumb may not be able to go around that bar. I know it looks small, but that may be too painful. You may at first just take the fabric and weave it in just a little. Of course, you can massage from here. This bone attaches to the wrist, so the more you move that, remember, you lubricate the joint by movement. The bursa creates synovial fluid, and it is movement that stimulates them to do that. So that's kind of the grease or the oil for that joint. But we want to lift that thumb and support under it. Eventually, after a while, you just keep putting a little more fabric under it, and you can slip it around. Now, you may not be able to leave it there very long. let it go back. This is a very gradual process. And if the person feels like you're hurting them, then they won't want to wear the splint again. If you tell them you're going to leave it on 5 minutes and then take it off at 5 minutes. Build up that trust. In order to put this on, you simply run the strap through there, the little ring. Always Velcro your, close your Velcro back on the strap. It'll save you a lot of trouble. This is a nice wide strap for the wrist. It really zones in on those people that have a lot of tone in the wrist or have wrist drop. If you have wrist drop and your strap is below the wrist or above the wrist, you're not doing anything to really reduce the contracture. You want that good 3-point leverage, and that means right over the center of that wrist. To add the next, everything we do is progressive. Oh, you can also, if you like, hook this to the wrist strap. Whatever is individually the best thing for your patient. We try to give you a tool that you can modify to use with your patient for their specific needs, because everybody's a little different. If you need to heat mold, it's very simple. You take this out and you heat mold the back, and you can refer to the videos on the Restorative Medical website for that. It's very simple. Again, you never want to have more than just about the space you can put your finger between the splint and the wrist. So you have a little room to come down, but the splint isn't down here and the wrist elevated. That is not good. To begin to open up the palm, we actually have 4 stages. You have the palmar bar, then you can use just fabric, and for this we have a threader. You put that on the Velcro hook, kind of wrap it around, and you thread it through the cone and just pull and tug. You take the threader off and you put it somewhere where you can find it, because you're going to want it to continually change the size of the cone that you're using. Again, if this is a cylinder or reverse cone, you would do the same thing. Pull it back through. The next size is you put the plastic in it. Just push it in until the cover goes over the cone. Again, you have your threader. You put it through the larger end on this one because it is the cone, not the reverse cone. Again, pull it and seat it on the hand splint. You see, the hands are so tender, but you very, very gradually increase the diameter, the range of motion. Then you can pull it out again to change the size. And the next would be the larger padded cloth cone. You put that on, and then the last size would be to take the plastic and insert it in this cone. And that would go on. Then you take your hand to this. Now, I've been told by occupational therapists for years that in their training, the philosophy was the ulnar side, the lower arm bone, this side developed first in utero when babies are in mom. So if we open the little finger side first, that's on the same side as the ulnar bone, it helps open the rest of the hand. But we want you to order what is specific for your patient's needs.